Hello, I'm Dr. Sarah Bauermeister, and today I'm going to present on some of the work from our Early Adversity and Dementia programme, which we run at the University of Oxford. So we're looking at early brain injury, child adversity, and the long-term effects on adult outcomes and dementia. So this work has been conducted on the Dementias Platform UK data portal across multiple cohorts. Childhood adversity is a broad construct encompassing extreme difficulties and adverse experiences during childhood, such as sexual, physical, and emotional abuse, also deprivation and family dysfunction. These adverse childhood experiences are considered highly stressful and traumatic, and they occur during childhood or adolescence and are independent of the normal stressful experiences that children go through during the growing up and maturation processing. Experiencing adversity during childhood alters the life of a child to such an extent that it may lead to adverse biomedical health outcomes in later life and adulthood, such as poor mental health, lower adult life satisfaction, and even dementia outcomes. So our aim was to investigate associations between childhood adversity and mental health, and also cognitive outcomes using retrospective self-report scales across Dementia Platform UK population cohorts. And we present some of our preliminary findings. Our initial work using UK Biobank across over 400,000 individuals, we looked at a self-report scale, and we combined these into a latent construct of childhood adversity. These questioned physical abuse, emotional abuse, sexual abuse, and also deprivation earlier in their childhood. And we regressed these onto later life outcomes such as medication usage, BMI, depression, happiness, cognition such as reaction time and memory, smoking and alcohol use as measures of lifestyle. And what we found was that this self-report early experience had a negative effect on all these later life outcomes, even if they were just self-report reflective measures thinking back on their childhood. We then took a further population cohort, the English Longitudinal Study of Aging, ELSA, and this time it was across 12,000 individuals, and we used different measures to form our latent construct, but we had two measures of physical and parental abuse and also a deprived childhood. Again, we looked at BMI, self-report health, depression, smoking, alcohol, cognition across memory and verbal fluency. And we found very similar findings as what we found in UK Biobank, that when adults self-reflect on how they had these experiences in childhood, this had a negative impact on adult outcomes, even in a self-reflection manner in these scales, using these scales. We then looked at a longitudinal effect of childhood adversity using MRC NSHD, which is the National Study of Health and Development, this time across 5,000 individuals. And our latent construct was using the parental bonding instrument, focusing on rejection and the question, father or mother did not want me. And we looked at cognition and mental health across 3 different time periods. The question was asked in 1989, and mental health and cognition was measured in 1999, 2009 and 2015. And we found that the reflection of childhood adversity had a long-lasting negative effect across all 3 of these time waves. Even when controlling for poor mental health on cognition, there was still a deleterious effect on cognition in later life. We then conducted an imaging study also using NSHD, looking at perceived maternal control during childhood, that it predicted the size of the dorsal striatum and reported well-being in older adults. Maternal caregiving strongly implicates the reward circuitry. and that maternal emotional neglect during childhood affects the reward learning and reward anticipation and is associated with reductions in the dorsal striatum region of the brain. So we took questions again from the parental bonding instrument, and we looked at images collected during the Insight 46 neuroimaging sub-study of the MRC-NSHD cohort. After exclusions, we ended up with a population of 394 individuals. All images were pre-processed along a pipeline using the Dementias Platform UK data portal and FSL tools. Participants were grouped based on their responses on maternal control using k-means clustering into low, medium, and high. The predictor was maternal control group, and outcomes were the core date left and right, putamen left and right, and well-being. Outcomes were adjusted for gender and birth weight by regressing these variables out and using the standardized residuals in the MANOVA. Groups were matched on multiple socio-demographic outcomes and MMSE scores. Results found that as maternal control increases, well-being decreases, and also core date and putamen size. Thank you for listening.